today regarding my physics, I have topics which is focus, multihertz, TGC, and 2D gain. So we're going to be talking about these four topics. Let me explain them one by one. So number one is focus. Let's talk about the focus. What is focus, and what's the importance of the focus on the image? Focus is actually when we send the sound to the tissue, it's the beam of the ultrasound. So where the beam of the ultrasound is inversion and after that diversion. So it just focus, it's the more dense on that area. So we have to fix our focus on the area where is the area of the interest. So it has to be at or just below than that. Let me show you in one of the images how it works. Let me share my screen with you guys. Okay, this is one of the ultrasound transducer. If we see, so sound goes all the way this way, but this is your focus area. On the focus area, we have to put our focus. It's a movable structure, or it's a movable system. So you can take it where you exactly want it to. It has to be on the area of the interest. For example, if the object is here, I want to scan, so my focus has to be at or just a little below. If it's here, so I have to move my focus where the object is, where the interest area of the study is. So, and in the case of if the focus is somewhere really here high and the object is somewhere here, so still you can see it, but it's not a good quality image. That will not give you more information. The focus, where you put the focus, that's like the more informational area. So keep in mind, always put your focus on the area where it's where the target tissue is, where the interest area of the interest is. So that's how it is. Let me share another image with you guys regarding that. Same thing, if you look here to the sound, so sound comes and it just focus on one point. So that focus is in your control. So you can move it up or down. So it depends. It's good to be on the area of the interest or just a little below of that. For example, I want to show you one of the image. If you look to this heart image on apical fourth chamber, so if this is an image and this person wanna scan the atriums, so this focus is not correct for the atrium. This focus is good for the ventricles because I can see both ventricles. It is at or just below on that apical area, but this focus is not perfect for the tricuspid, for the mitral valve, and for the atriums or IAs. So it has to be at or just below. So if I want to scan the valves, both AV valves, so I have to put or bring my focus a little down to this point or a little bit below that, like this much, but not really below. That will be also not correct. So focus, that is really important, has really important impact on the image. The second thing is a multihertz. Multihertz is one of the knob. We use that to change the range of operating frequency. We cannot change the frequency of the transducer, but only we can change operating frequency. Maybe if a transducer is working between 5 to 10 megahertz or 2 to 5 megahertz, so only you can display, you can play with that to bring it to 3 megahertz to 4 megahertz, 5 megahertz, 2 megahertz. So you can just, it depends. If the structure is really deep, so just bring that operating frequency to the 2 megahertz. If it's kind of superficial, not too deep, so it depends on the structure. So you can take it back to the 5 megahertz or to the upper limit. So that's the multihertz. TGC or DGC or SGC. This is TGCs, guys. So normally each machine have 8 TGCs. The first 4 are called near field and the last 4 is called far field. TGC and 2D gain kind of have the same job, but the only difference on their function is TGC works in a specific area. You can make your image on the specific area to make it darker or make it brighter. It depends. Somewhere we need to make image or brighter. In some part of that image, we make it darker. But 2D gain is different. That 2D gain will make your entire image either brighter or darker. So that's a little bit different than, for example, if I look here on this image, It's the T gain. I believe this is the M mode. This is, I believe, the 2D gain. So if you play with the 2D gain, that will make the whole image brighter or darker. But TGC work in selective area. So we cannot make our image too bright on the 2D gain. If you look at on this image, this is too much brighter. So we make, it's a tech error or a doctor's error because the image is too much brighter. If it's this much brighter, so we make a calcification. We make a false positive pathology. And also we cannot make it to the point too dark because we can hidden a pathology. So we have to play between, not too dark, not too bright. Let me have this image, these. So for example, if my optimal image is this one, then this is really low gain. The 2D gain is really low, so I cannot see the normal tissue. And then this is a high gain. So in this case, it looks like a pathology, so which made by the machine operator. So it has to be not too bright, not too dark. It have to come. So your eye has to be judging that. So just have to be a little careful about this. So those were the 3-4 things. I think it's easy to understand. So the focus, always put the focus on the area of interest or just below than that. It is movable, so you can move it. And multihertz, if you are using any probe which has a range of frequency, so you can use this for the deeper structure, bring to the lower frequency, operating frequency. But if you're scanning something kind of superficial or comparatively not too deep or shallow, so the same probe you're using, bring it to the higher frequency limit of that operating frequency. And then for the TGC, time gain compensation, or DGC, depth gain compensation, or SGC, which is also called sweep gain compensation because you can move it, that's why it's sweepable. That's also, we can make adjustment. Somewhere we need to make it darker, some area of the image, and some area of the image need to be brighter comparatively. So we use that. For the arterial studies, we make it like one lane straight, all of them in the middle. So we have a room for make it brighter or darker. So put always your TGC in the middle. So you have a room for darkness and brightness. And for example, for echocardiography, we make it like a crescent, like a parabol, like a curve. The near field is darker, and then all is brighter, and the far field is darker too. Except for to rule out the first image if we're looking for pericardial fusion or pleural fusion. So we make the near field darker and the far field brighter. So, and the 2D again, we cannot make image too bright because if it's really bright, then we cannot do our diagnosis. If we are the one, the doctor, to diagnose, or if you're sending this study to somebody else to make a final report on it, then it has to be a clear image. So come to an optimal image. There's not a certain range to say how much decibel you want on the 2D again, but it is your eye, train your own eye. If you can do diagnosis on that brightness or on that specific resolution of the image, then your doctor also can do it. So it's important to know what is the normal brightness. It's going to be your own judgment. So there's not a specific number for that. Please leave comments to make it better, and don't forget to subscribe. Thanks a lot and have a good day.